Dr Mazhar I am working as National Team Leader Health with Islamic Relief Pakistan. Major illnesses that are prevalent among the flood affected population, initially acute respiratory infection, chest infections and diarrhea were the most common ailments. When our team started delivering health services, acute respiratory tract infection prevalence has come down. Diarrhea has been controlled somehow. As you know that poor hygiene leads to skin infections. Whenever people are out from their homes, water is stagnant all around their homes and they don't have clean water to wash their hands, wash their face, to wash their clothes. So they are highly vulnerable to get infected with the skin infections. We have strategized to address these skin infections through an integrated approach of social mobilization and health and hygiene promotion, supplemented by the treatment of the patients coming to our mobile sport unit sites. Malnutrition was one of the burning issue in Pakistan, and perhaps the most affected population in terms of malnutrition were the southern Sindh. The recent floods, back-to-back two floods, has played havoc in Sindh. That was the reason that Islamic Relief Pakistan opted to incorporate nutrition as it's one of the key intervention for flood emergency response. So we had separate exclusive staff for nutrition services, which are going along with the mobile support units, and the set of activities which they are performing, that they are screening the malnourished children and patients living with malnutrition and pregnant and lactating women. And after screening, the malnourished children are categorized into mild, moderate and severe, and mild and moderate are given the basic treatment with the support of UNICEF and WFP, and the severe malnutrition cases are referred to a therapeutic center established at the district headquarters hospital. We have deployed qualified female staff, women medical officers, lady health visitors and nurses to take care of the female population, and similarly the male staff is looking after the male population. Selection of the areas for the flood emergency response intervention was primarily based on the needs of the population and the existing healthcare coverage. We conducted a rapid assessment in the start and identified two UCs of District Badin and Mirpur Khas. The base for this identification was, number one, the areas which were highly affected, number two, the areas which were not having access to the primary healthcare services, and right now in the four UCs we are working in both districts. Most of the areas, they don't have access to any other healthcare facility, government or private, and Islamic Relief is the only organization which is providing them health and nutrition services at their doorstep. And our teams work through a micro plan, and we have tried to ensure that none of the village, no matter how far away it is from the center of the main road, remains uncovered. This is an uphill task, but Islamic Relief is quite confident, and the commitment of our staff working there and the support of the partners who would be able to overcome the major health issues of the population